Welcome back. I'm Beverly Onstead. We're on location at Tri-County Podiatry in the Villages.
And I'm Mark Roberts. It's that time of year when the flu season and allergies are converging, leaving some people wondering what's driving their nasal dripping. Historically speaking, February is generally peak time for illness. So far, winter's been mild, and so is the flu season. With that mild winter comes an early spring and early allergy symptoms. We spoke with Ed Neuzil, registered nurse practitioner at Allergy, Sinus, and Asthma Family Health Center, about how to differentiate between allergies and something more serious.
The heredity part just predisposes you to developing these allergies, but you can do this all on your own. And if you do have a grass allergy, of course, the best thing to do is just avoid it. So you would want to, if you've already identified that, every time I mow the grass, that my nose runs, my eyes itch, I don't feel so well, my breathing isn't so good, and that's the only time you have a problem, the simple answer is don't mow the grass. Go ahead and let somebody else do it for you. However, the problem comes in is you may develop more allergies. You may have developed allergies that you can't identify, and that's where it becomes a bit more difficult and not so simple as, well, just don't mow the grass or don't touch the cat. Very commonly I have patients come in and they say, well, my throat was scratchy the other day and it was a little bit hard to swallow. It's getting better, but now my head's all stuffy and my nose is plugged up and it's running, but everything is clear. Okay, so that's generally more of cold-like symptoms. Flu, you're generally looking at something a little bit different. You can actually have the nausea with or without vomiting. You can have gastric cramping. You can have diarrhea. These are more of your flu-like symptoms. And that's why I tell everybody that the use of the flu vaccine is almost a must, especially up here because of what they call the comorbid conditions. For years, we've told people you need to rinse out your nose. You need to keep the pollens, you need to keep the debris out of your nose and help reduce the exposure. However, if you're on the golf course, there's no way you're going to pull out your little neti pot and flush your nose and get all that stuff out. So that's why here, approximately 3 years ago, a little bit more, we developed the nasal rinsing spray, which is now known as Dr. Neuzil's Irrigator. And it's something you can do when you're playing golf. You're out there, you're a little stuffy, you can reach in your little golf bag and you can do a couple of sprays. And if you don't blow your nose, you don't blow your nose. And if you can, that's even better. But it'll actually clean out some of that pollen. And if we reduce the exposure, we can reduce the incidence of symptoms.
Ed Neuzil saw so many patients with sinus and allergy issues that he decided to develop his own herbal enhanced saline spray. Hometown Health reported on our Facebook page last month that Dr. Neuzil's Irrigator has earned the coveted parent-tested, parent-approved seal of approval. The herbal enhanced saline spray was selected by unbiased parent testers seeking effective and easy-to-use products that benefit the entire family. Irrigator nasal spray is available locally, online, and in retailers in more than 20 states and Puerto Rico. You'll find a list of retailers on the Irrigator website, which you'll find along with more information about allergies, allergy testing, and treatments at the Allergy, Sinus, and Asthma Family Health Center in Lady Lake when you visit the Allergies or Flu story link at yourhometownhealth.com.